So you've been given the go-ahead to go ahead and get that COVID vaccine in Maryland. You sign up, and yet you wait and you wait and you wait, and you still haven't received an appointment. WMAR2 News' Jeff Hager has more on how the limited supply is raising some questions here throughout our state.
First doses, second doses, no doses at all. Frustration is mounting here in Maryland as demand for the vaccine continues to outstrip the supply. Tension mounts within a Senate work group in Maryland as it focuses on the numbers and the predictability of COVID vaccines.
It looked like there was 88,000 that came in, and at least if we're projecting 88,000 per week for the next 3 weeks. Is that 15,000? Is that just for the health department to use?
Health departments versus retail pharmacies, frontline workers versus the elderly, and those receiving first shots versus those still awaiting second ones. Yet supply is limited to just a fraction of those who need it. Not to mention the federal government delivering less supply this week than last.
Today, I've heard that multiple hospitals and health systems are having difficulty getting second doses for their healthcare workers, that there are second doses that were supposed to have been delivered last week that are still missing and have not materialized.
That is correct. We think that in the transition between the two administrations, HHS has been having a struggle reconciling the data.
It is a dire shortage of the vaccine that leaves critics wondering why the state is planning to open 6 mass vaccination sites when it can no longer guarantee the amount of vaccine which will be directed to local health departments.
Based on the past, if it's in Western Maryland, you're going to put it in Hagerstown. That always happens. What good does that do anybody in my county? I mean, we're still trying to get 75, 80-year-old people vaccinated, and now you're telling me they're on all these waiting lists and they've got to drive to Hagerstown?
Jeff Hager, WMAR 2 News.